So let's proceed now to David Ehrhardt of CASTALIA Strategic Advisors. David's the chief executive of CASTALIA, and he was also the leader of the recently completed review of results-based financing in WASH, which was a research study commissioned by the Gates Foundation in partnership with DFID and WSP. So the comprehensive review of RBF projects was done to assess whether and how RBF schemes might be used to help accelerate the expansion of WASH services, especially sanitation, to achieve MDGs and ultimately universal access. So they've done an extensive literature review and analysis, and CASTALIA as an agency is also deeply involved in a number of very practical on-the-ground RBF scheme designs and evaluations in a number of sectors, not just WASH. So with that, why don't we turn it over to you, David, and give us an overview of your research findings. Go ahead.
Sure. Thanks a lot, Peter. And look, I just want to try to make this pretty simple, I think. What we... there's some things that are very obvious when you've studied it for a while, but maybe not so obvious when you first come to it. Which is that RBF, as others mentioned, is a tool to an end, and you have to use the tool in the situation where it's appropriate. And so that's why I'm starting with kind of minimum conditions in which you would even consider using RBF. And I want to focus here on the kinds of RBF that pay for outputs as opposed to... So, look, just what conditions would you even consider using results-based financing? And I want to focus on the kind of results-based financing where you're paying for an output either through the output-based aid that Will talked about or by providing a voucher. Because I think... and not dwell in the 5 minutes on the conditional cash transfers. We can talk about those in the broader discussion if you'd like. So because these schemes are paying for an output, really should only be used where you know what output makes sense. So one has to know that a particular intervention, such as a particular type of latrine, for example, would improve sanitation outcomes, and that people would use that. And you also need to have a situation where government or donors want to cover some or all of the costs, because it is a payment from government or donors toward the provision of that output. And the payment has to be made when the output has been provided and is working, which means that it must be possible to specify that output and to monitor its delivery and to monitor it in all its essential dimensions. And I think some of the really excellent questions that people have been bringing up go to that. How can we know that the voucher will be used for building a toilet and not given to someone who will pretend to have given you toilet materials but not really have done so, and instead go and just cash it in? So that's a real risk, and I think one should only use RBF where you're confident that it's possible to reliably monitor that the outputs are being provided. Otherwise, it's really going to be a waste of money. And finally, one needs to have capable and motivated suppliers who are able to provide the output. And so this is, I think, relates to what Min was saying. Look, if you don't like risk as a provider, then you might not go for the output-based aid payments or the voucher payments because you're not sure that you can deliver. So one has to have suppliers who are willing, who believe they can deliver, and who want to deliver those outputs in exchange for the payment. So if any of those conditions are not met, then RBF is very unlikely to provide value for money. But if those conditions are met, then there's reason to believe that it should provide good value for money. And I think these conditions are often met in a lot of donor spending on sanitation. And this is where I think again, we need to provide some context that results-based financing is certainly not perfect, but frankly, no system for supporting sanitation is perfect. So the question is to compare different approaches. So I think it's always helpful to look at the strengths and weaknesses of RBF compared to a conventional government or donor-funded program, and say in any particular circumstance which is likely to work better. So you can see on this slide that the conventional donor program pays mostly as inputs are provided, with typically a final completion payment, and that has a higher risk that the facility would not actually be there, or would not be used for a period, or not be used because it would break or not be appropriate. So the results-based financing is trying to just get a little bit better than that by making sure that the payment is made for an output that has been delivered. So in theory, this seems logical. We were trying to find out whether or not it actually works. And I guess there's various dimensions to what works. The first dimension would be effectiveness. And on this diagram, it's a little complicated, but it's, I think, rewards study. On the left-hand axis, we have measures of effectiveness, which is, did this project deliver the level of outputs or results that were expected? And on the horizontal axis, we have the size of the project in terms of population served. So high effectiveness means delivered 100% or more of the expected outputs. In some cases, the projects that we looked at did not specify the expected outputs, or we weren't able to find those documents, so we had to make a judgment. And if you look at it, you'll see that RBF schemes are working in the sense that the great majority of them deliver 100% or sometimes even more of the expected outputs, and very few of them are in that low category of delivering less than 50% of the expected outputs. Something else but on the other hand, I think perhaps unfortunately, most RBF projects are not working at a large scale. So you see the logarithmic scale for people served at the bottom, and below, almost all of them are below 500,000 people served. Many of them are around even 50,000 people served. And so to be an effective tool in our toolkit, we're going to have to make RBF work at larger scales. On the other hand, something that's quite encouraging is that many of the projects that have worked and worked at scale have worked in really low countries that have got fairly low capacity at low levels of income, like Bangladesh. You see up there in the top right-hand corner the Bangladesh Wash Vouchers Program, or Senegal or Mozambique, sorry, with the a water RBF project. So that this is a bit surprising, because you'd think that RBF would have more monitoring requirements and hence perhaps be harder to make work in low capacity environments. But in fact, we see that it is working quite well in some of those environments. But what we'd really like to know is, are we getting more bang for our buck and systematically from using RBF? And in principle, we should be. Unfortunately, there isn't really evidence one way or another on this. So you'll see that we tried to benchmark the costs of outputs under RBF programs and conventional programs, and they're in the same range. So there's no evidence that RBF is less efficient than conventional input-based financing. But it's also with the current data, not really possible to say empirically that it's more efficient. And that's because projects are not being designed to allow like-for-like comparisons. So I suppose where I come out on this is, if you're in a situation where governments and donors are planning to fund a sanitation project, and where the results are known, we know what we want provided, and we can measure if it has been provided, I would recommend using RBF because I think in principle it has advantages over input-based financing, but not necessarily using RBF exclusively. I think what would be most useful would be to run things side by side, like Choba did, and try the conventional way of doing it and try the RBF way of doing it, and keep some records of which approach is more effective, and also crucially, which approach gets more people helped per dollar spent. Thank you. Thank you. Let me have a go at answering that one and see if I've understood it correctly. You know, partly this is just definitional. So RBF involves payment for results. Who is paying for the results? I think by definition it's a public sector entity, either a donor or a government. So I want to contrast that with, say, market-based schemes where, for example, you try to create demand, link supply chains together, provide microfinancing, for example, so that people can afford something that they want but which they don't have the upfront money for. Those are great ideas. But those ideas involve people paying for sanitation themselves. RBF is not that. RBF, by definition, is someone else paying something. So I guess what I'm saying is that just as a matter of definition, you have to use, if you're talking about RBF, you're talking about government or donors either paying for the entire cost of an output or paying for at least a part of the cost of an output. So that's just definitional, but I also think it's helpful because you know, in many countries, governments and donors are paying for sanitation outputs. And so where I see RBF as particularly worth considering is where a government or a donor is going to go in and intends, for whatever reason, to provide subsidies for sanitation services for facilities, and they've decided to do this. I think they should at that point stop and say, would we get more for our money if we paid when we're sure that the outputs have been provided and are working to specification instead of paying for inputs? Right, well, Leonard, thanks for providing the link. And Jeff, great question. Thank you. So on the effectiveness, I have to say, in my opinion, all results-based financing schemes should set targets because they typically have a budget. They typically have a price per unit of output that is to be achieved. And so obviously you should have a target for how many outputs are we going to achieve. And the effectiveness is simply, I think, using the DAC criteria. It's that use of the word, and it's, is this project doing what it sets out to do, which in the case of an OBO, a voucher program, is to have certain outputs achieved. In that context, high means 100% or more of the outputs. You might wonder how it can be more than 100%. It may be possible that the price of the output is less than was first thought. For example, one that really outperformed was the Manila Water project to provide improved water access in low-income areas in Manila. What happened is the cost of providing a connection from the suppliers went down so they could do more with the money. That's why that's at that level. Between 50 and 100% of the output we classified as moderate and below 50% as low. Now, in some cases, there was no target, and in that case, we made a judgment based on what we felt they were trying to do and how well we felt they had achieved. Which is perhaps, I mean, certainly I found that unsatisfactory because I thought they should have had targets, but we needed to do, so the alternative would have been to not process that data at all, so that's what we did.
I'm going to jump in with my prerogative as moderator and ask also on this point, since Choba is asking these questions, and I had the same question when I read your report. Where on this chart would you put the Choba project, David?
No, that's a great, I like that question. Unfortunately, when we were doing the analysis, we didn't have the results from Choba yet. And so I don't know, I don't think I know what the targets.
We have another 25,000 or 30,000, I can't remember, what we call the stretch goal. So at that stretch goal is going to be lower than what we have agreed with the Gates Foundation because of the economy of scale thing. So I would put Choba on top. That's where we are, both in Vietnam and Cambodia. For, you know, we have the data all transparent. Okay,
so David, if the achievement on Choba is high, scale I don't recall, but so it would probably be somewhere around maybe the Senegal's spot, or maybe a little bit to the left of that in terms of scale. I can't exactly remember where their final figures are. I think I wasn't sure if Jeff had, so 750,000, so about 100,000 something toilets and 700,000 beneficiaries. So maybe sort of in the middle to high side of that chart. So that's great. Very good. Okay. I think we need to move on.